Eva came to me because she'd had a very unfortunate experience, which was that you'd been diagnosed with breast cancer.
The toughest time probably in my life. Just hearing the word cancer is just, oh my God.
She's not even thinking about herself. And I wanted to shake you and say, think about yourself. Don't worry about anyone else. Was there ever a conversation about the potential of your breast tissue being removed? Hi guys, welcome back to Emily Abraham Presents the Love Luxury podcast. Today I have with me a lovely guest who's been very gracious coming on today, and her name is Eva. Hi Eva.
Hi.
Thanks for coming today.
Well, thank you for having me.
It's my pleasure. So just before we started, I was saying I asked you a few questions, and I always have to stop myself from getting into conversations with people because I really do want to save it for everybody else to hear. So just a brief rundown of how I met Eva. So I had a clinic on Harley Street and I was doing microblading eyebrows, and Eva came to me because she'd had a very unfortunate experience, which was that you'd been diagnosed with breast cancer.
Yeah.
And Eva came to me because she knew she was going to be going through chemo and other treatments, and so wanted to have her eyebrows done before her treatment. Were you referred to me by the hospital? Did you find me first?
I found you.
You found me
by myself, on the internet.
And then after I treated you, you gave my details to the hospital,
I
and
did.
then the lady calls me.
Yeah.
So what we used to do at Harley Street is we would treat one client for free every month, and then we would treat other clients at half rate. And that was just a little bit of us giving back for people that were suffering any type of cancer that they needed treatment for, or any type of illness actually that would cause hair loss. So that was just something we did. Adam and myself is one of the things we did then at that point. And that's how I met you. So you found us on Google and you came in and we had a consultation. And obviously at that time of meeting you was a really tough time for you.
Oh, it was the toughest time probably in my life. And then also just as, knowing what you have to go through, and then, and then also just that you need to, first of all, that all your hair is gonna fall off. So, yeah.
What struck me when I met you the first time was your positive outlook, because you weren't the first client that I'd met that was in that position, but you had this really positive outlook, and that was that they'd caught it quite early on, and the doctors were saying that your chances of a recovery were really high. And you did have to go through the stages and the procedures of everything related to your diagnosis, but you were you just struck me as just so positive. And I remember talking to you and asking you things like, who have you got here? Are your family here? How many friends have you got? Because my heart went out to you, because I was like, where'd you come from, first of all? What country are you from?
I'm from Denmark, yeah. And all my family and majority of my good friends are all based in Denmark. I do have good friends here as well, but I had to pretty much go through this whole process by myself. I had a few friends who obviously helped me, supported me, I had a very, very good friend who's Danish as well, who lives here, and she went to all of my chemotherapies with me, and majority of my doctor appointments. When she couldn't make it, a few other friends will step in. So I always had a friend with me, but majority of it, like the whole period of being sick at home and taking care of myself, that was majority by myself. Yeah.
Which is really hard.
Yeah.
It was really hard on you. Could not have been easy.
It wasn't, but I think that also made me keep going, because if I didn't make food, nobody else did. So I kind of had to, take care of myself, and also for me, I think the whole process was a little bit of awakening for me, and then I started, looking into like processes, for instance, for like food and whatever, all these good things that I could give my body in order for my body to recover better. So I did a lot of studying into like environments and diets and all this stuff. So yeah, and I'm still pretty much practicing majority of it now. I'm a little bit more loose now, but back there I was really, really strict on not getting, too much processed and all stuff. So I kind of combined like a diet for myself in order for me to, I guess it turned into like a little hobby for me to actually recover better, and which I had really, really good results with. So yeah. Yeah.
So when I met you,
Mm-hmm.
you literally had just got the diagnosis,
Mm-hmm.
okay? And we had to plan your treatments between you, before you starting and then after you starting. But you also still carried on working.
Yes. Yeah.
Which again struck me. I was like, this woman's here. She's on her own.
Yeah.
She's got a couple of friends. She's got none of her family support network. And she's still soldiering on with work.
Yeah.
Now, most people in your position, not most people, but some people, I can't say most people, some people in your position would have just panicked,
Mm-hmm.
thrown their hands in the air and be like, I can't work. I can't function. I mean, I think that's probably what I would do
Mm-hmm.
in that instance. So I was very, I had a lot of admiration for you, because I was just like, this woman is just, she's just acting like it's not happening, but she knows it is. You were very pragmatic about it. You still carried on working. You still were coming to me in between working schedules and treatment schedules and appointments and everything. And I was just flabbergasted actually by how strong you were as an individual, or are as an individual, and that really endeared me to you, because you're this bubbly, lovely, warm, friendly person who's going through this massive life drama, and yet you actually didn't let it faze you. Was it like that all the way through?
Oh, absolutely not.
Thanks for being honest.
Yes, no, definitely not. You come to a point, well, I did. First of all, getting it diagnosed is just, whoa, like you don't even believe it. And it just hearing the word cancer is just, oh my God, yeah. You don't really understand what is actually happening to you. And you go through a lot of phases, or I went through a lot of phases. And there was a point where I was just like, either I could fall into a deep hole and then just sink into that, or I could take this and make this the best thing that's actually ever happened to me, which I chose to do. But I was tipping over. I was thinking at a few points that if this takes me, am I actually okay? It would actually be a relief. So I did have all these bad, periods of time during this whole process. But every time I was just like, no, actually, I could actually change a lot in just me and who I am. So I did a lot of mindfulness. I listened to a lot of podcasts actually as well. All this, self-love. I went to a self-love coach as well. And then, just got a lot of positive thinking instead of, letting it take me somewhere else where I didn't want to belong to. And I learned a lot by myself, incredibly a lot, because as we spoke earlier, like I did a majority of this whole journey on my own. So I learned a lot about just me as an individual, I learned how important myself is. Like, I learned to love myself. I'm super proud of what I've been through and how I came out of it on the other end. Like, I'm a completely different person today. I've just become the person I've always wanted to be, and allowed myself to become that person because, well, there's a reason for why you have to go through such a process and then come out of it at the other end, So, yeah.
Which is really admirable of you to be viewing it like that, because it's so easy in that instance. I mean, look, we know you had your diagnosis. We know you went through your treatment, and we know you're here now. Okay. How many years have you been free, cancer free?
Coming up 4 years now. Yeah, June, I think it's 4 years. I was, when was it? So I was diagnosed in 2019 and was diagnosed cancer-free in 2021. June 2021. So yeah, about 3 years. 3 years. 3 years now. Yeah, 3 years now, I think. Yeah.
So yeah, to me, it's really admirable, because going through that process can make some people jaded. Yeah. And like I keep saying, you are a person who took this, and you've just proven to me that actually it was a really negative thing that happened to you, but what you did is you turned it into a positive, and you turned into the person that you always wanted to be, which is what you just said to me.
Yeah.
When you say that, what do you mean? What about you did you change?
I've become, what about me did I change? I think I've become like a lot more positive about life and the world and what's happens around me. Like before, I was very, I felt like the universe was always against me.
I understand that.
Yeah. Yeah, which majority of people feel sometimes. They will go through periods where, nothing works and they just feel like they are losers or whatever. I probably felt it all the time. So I never really was proud of myself. I always felt like I was probably really, really hard on myself, always. And it was just a lot of things. I was also overweight, and and there was just so many things before all of this happened that put me in a place where I was just not happy. And again, the whole universe was against me at all time. Where now I do still feel that the universe sometimes is a little bit rough, but majority of the time I am really good at, turning it around and being a little bit more positive, and I become more outgoing as well. I'm not as shy as I used to be. And also I'm just become, if you can see, like a little bit more brave. Yeah. Before I would probably never go and talk to a stranger, where now I have no problem. I'm just becoming more out there. I want to be seen more. Before I wanted to hide. Now I want to be seen.
Because life is short.
Yes, exactly.
And it's for the living, isn't it?
Yeah, exactly.
I understand that.
Yeah.
I do. I understand your thinking process.
Yeah.
A lot of people who are going to watch this will have had bad experiences in life, and some will not have been able to use them in a positive way like you have or like I have. But before we get into that kind of stuff, can we roll it all the way back to how you found out? So what made you go to the doctors? What was the circle of events that happened that you said, I need to go and see my doctor?
Well, I've always touched myself, like occasionally, but it's been a hard thing to do, and I think a lot of women actually find it a little bit hard because you are afraid of what you actually might find, or what you can feel. But there was just something that told me that day. I've done it occasionally, but maybe every 6 months or something.
So sorry, let me just stop you there. When you say touch yourself, you mean done a breast check?
Yeah, breast check.
Yeah. Okay. Because someone else might think you meant something else.
Yeah, no. Sorry, a breast.
Okay, you did a breast check.
Yeah, a breast check. And there was just one. That day where I actually felt it, there was something that just told me to kind of like, and today is today. You have to check yourself, and I did, and I found it was just a little tiny lump.
So when you say tiny, was it the size of a pea, a grape?
When they actually came out, it was less than 2 centimeters.
So half a grape.
Half a grape, yeah. And I could feel it, but at that point, I was also, maybe it's in, depending on your cycle, whatever. Maybe it's not really anything. I'm gonna try and touch and see if I can feel it in like 2 weeks' time.
Was it painful?
No.
Pain-free?
Pain-free.
So we're looking here for pain-free small lumps.
I wouldn't think, I don't know, I'm not a doctor, but majority of the time cancer don't hurt.
Okay.
Yeah. Then I felt it again 2 weeks after, and I actually went to my GP first, and she felt and touched it same as me, but she couldn't actually feel anything. But she thought that I had quite lumpy breast just naturally.
Okay.
And so she was more like, okay, well, maybe we should just get it looked into. But I can't really see anything. I can't really feel anything. And I then got, what's it called?
Mammogram?
No, I got
referred.
Yeah.
Yeah.
Referred to the hospital. First I was then... the first thing I did at the hospital was also another doctor coming and trying to see if he could feel it. He couldn't feel it either. But he was like, let's just do an ultrascan. And on the ultrascan, they then saw that there was a little tiny lump, which they couldn't see. They couldn't identify what it was. So they did, they took a...
biopsy?
Yeah,
mm-hmm.
Exactly. So they took a little test of it. And I think it was a week after, maybe it was a couple of days after, I received a text message that I had to come back. And already there I was a little bit in panic, but I didn't think, okay, maybe, they messed up the test or whatever. But when I came back, the nurse came in to me and she was like, are you here by yourself? And I was like, yeah. And she was like, okay. And I got then directed into a private room and everything where they just told me that, they just laid all on me. And unfortunately, it came back as cancerous, and it was one of them that is the most aggressive ones. So there is... I think there's about 200, 300 types of breast cancer, and every treatment is very bespoke to that person or to that cancer. There's very, very few treatments that is actually the same. And mine was the type of cancer they call triple negative, which is a very rare and very aggressive cancer, and majority only happen in like younger people. So they had to act really, really quickly. Pretty much they wanted me to go into chemotherapy almost the next day, the day after. But in that case, like, I have not had children yet. So
I remember us having this conversation,
so I had to go through a whole fertility program. So it was like IVF, like a speedy in 2 weeks. Where I had to, that whole process was just like very overwhelming. yeah, and like everybody that has gone through IVF, it's horrible. It's absolutely horrible. You have to pop yourself with hormones and everything, and needles everywhere, and I had to do a 2 weeks process of it, and then into surgery straight away, get my eggs out. So I have currently 11 golden eggs frozen waiting for me. And then pretty much started chemo straight after that.
How old were you then?
I was, how old was I? I was 37.
37.
Yeah, 37, 36 or 37. Yeah.
So that's a double whammy.
Yeah.
So they've just told you you've
Yeah.
got breast cancer, but on top of that, you're having to go through IVF,
Yeah.
essentially, to force your body to create more mature eggs for the cycle so that they can harvest them, to freeze them. And that's a very painful process.
Yeah.
I've not personally been through it, but I know friends that have, and it's excruciatingly painful.
It is. Yeah, it is. But I don't know. I just let my body almost go to these doctors, and they could just literally do whatever. The only thing I could focus on was me and how to make my body as healthy as possible for them to be able to do whatever they have to do. So yeah, it was. I think that was probably the mildest process of it all. But it was from as soon as I got diagnosed until I had to go through that. I also had to go through like bone scanning because they had to look my entire body if anything else is hiding anywhere. So I had to go through so many tests. I think it was as soon as I got diagnosed, I pretty much got pulled out of work for 3 months. And during those 3 months, I was at the hospital every 2 to 3 days, either in meetings, either in some tests that had to be taken, anything really, so they could make sure that I, got the correct package for my treatment. Yeah.
So you said, and we've talked about the fact that you had no family there. How hard was it to tell your family?
It was very hard. My parents are. I'm not super close with my parents, but they are two very, very hardworking people. They have worked so hard to, just get life going, basically. But they're not as strong individuals. Like they also suffer from their own, mental health and just illnesses and everything on their own. So I knew that this would be tough on them. And it was, it was hard to tell them, but at that point when I told them that, I actually didn't know what was actually happening to me. So, I was just overwhelmed that the doctors just said, oh, well, it will be probably a year's treatment. I was like, a year's treatment? Like, no, I'm just gonna literally just, starting my career, everything. Yeah. So at the point when I told them, I wasn't actually aware of what was actually happening to me, but they were the first people I called.
That couldn't have been easy for you to deal with.
No.
Because I remember that actually when you were talking just then. I remember when you were laying on my beauty bed and we were having this conversation, and I remember you saying to me how concerned you were about their feelings. And again, it was something that endeared me to you, because I just thought, of all the people that you should be worrying about right now, it should be yourself. And actually you were more concerned about how it was going to affect your parents in the long run. And I did, and I was, that actually shocked me quite a bit, because I was like, she's just not crazy, but like, how can I explain it? She's not even thinking about herself. And I wanted to shake you and say, think about yourself. Don't worry about anyone else, you know?
Yeah.
But obviously, being there as a listening ear, I tried to comfort you as much as I could, you know, being someone that's a relative stranger to you, you know. So basically, you were diagnosed, you went through the IVF, and then you started your treatment. How soon, first of all, let's just talk to me, but informing the audience, how did that treatment feel? What does it feel like when because essentially you're being pumped full of not very nice stuff. Yeah, it's actually designed to kill every cell, not just the bad cells.
Yeah, chemo is it's tough. It's not like it's really not just the whole cancer world. It is kind of a little world. Nobody really should actually enter that world at all. Like it is. For me, so I had 2 sets of different chemos. The first one, I was actually allergic to.
Oh my God.
Yeah, where
Poor thing.
so it actually, the first time and my first day at chemo, they have then planned which one I needed to get, everything. They set it all up. For me, I was very concerned about my hair, my looks, and the worst for me was probably to look sick. I just didn't want to look sick, and this was also where you came in the picture, because that was with the eyebrows, and I just, that was my worst, was that people could see that I was sick. So for me, preserving my hair was very, very important. And they do offer you to get like a cooling cap at the hospital, but it will prolong your treatment with like 4 extra hours or something. Wow. So you sit at the chemo center for that long. They have, it's also a little bit of a strange room. But they have all these chairs, and they're actually really comfortable. There's heating in majority of them, and it's really nice. And they set you up with a blanket and everything, especially when you have the cooling cap. But then you start your treatment. So, and it was my first day, and I get the chemotherapy, and I can't breathe. Yeah, and as soon as I said that, they obviously stop it, everything, and they are like, okay, this is not going to be today. They need to look through what it is. There's definitely something that you're allergic to. So that was my first day, which was not a great start, because you're so worried.
Of course.
But then I got signed to another type of chemo, which is actually a chemotherapy they also use for, I think it's bone cancer.
Okay.
And this one is a bit milder, but I didn't really get that sick of it either.
Okay.
Which was great. Which actually meant that my work has been amazing during this period of time. So they pretty much just let me come and go as I pleased. When I had to go to treatment, I would go to treatment, and if I didn't feel like working the day after, it was also fine. And on the first set of chemo, I could actually go to the gym the day after. It didn't affect me much. But it's different from person to person. So it really, really depends on your own immune system. It really depends on your mindset. And there's so much that reflects in the whole process of your treatment. And for me, it was just my focus was to keep myself as healthy as possible, which then also required me to going to gym, make sure I did my exercises. So I actually went to spin sessions just the day after lots of my chemo sessions, and I was actually fine. But my last set of chemos, which is also one of them, they call the Red Devil. So it's purely red. It looks like poison. And that one, that was... I think I had that for the last 3 months, because you have it every 4 days or something, well, every 5 days or something. So you have it you have to take a break in between. And that one was tough. I was very sick, like proper sick. There's lots of smells I can't, still today, I cannot. It makes me really, sick thinking about it, because I just relate to how sick that actually made me. But yeah, then but for, again, majority of the time it was just to keep my body as healthy as possible. And I don't even think it took the whole way of the chemotherapy before they actually realized that it has actually strengthened it, like proper strengthened it. So my medical team definitely thought that it was down to my mindset, and also how I've been treating my body, and also my diet. So they definitely think that, majority of whatever I was doing correct. So so I should just continue doing that. But but I was one of them that had 100% response on chemo, which is quite rare with the type of cancer that I had. A majority actually is actually only 25% that has a response on chemotherapy with the type of chemo cancer I had.
Was there ever a conversation about the potential of your breast tissue being removed?
Yes. So I think you have to, everybody goes through lumpectomy, either a lumpectomy or a full mastectomy. That was also a discussion. I could also have chosen to do that just based on the type of cancer I had. But talking and discussing it with my doctors, they were all like, "You're still so young, and you should preserve as much as you can of your own." So I chose to get a lumpectomy. And yes, so they go in and they take the old tissues out. They will also take a few of your lymph nodes in order to check that everything is gone.
The more I hear your story, the more I think that you are just the most brave woman I've probably ever met. I honestly mean that, Eva, because I feel a bit emotional.
Oh,
Sorry. I don't actually get upset, so I'm really sorry about this.
No, you're making me emotional.
For you to go through this alone, I know you did have some friends with you, but I just can't believe how brave you are. Honestly, because I'm sat here thinking, if that was me, I think I can't even sit in the back of a car without going, "Stop the car! I feel sick. I gotta get out. I need some fresh." Like, I'd start panicking. And you were going through that feeling by yourself for 3 to 4 days, and this was a 6-month long period. You were getting up when you were feeling good. You were batch cooking yourself food. You were pre-preparing everything in advance. You were getting yourself to all of these appointments. You were still working, and you just did it all alone. And that's what my heart is like, I want to cuddle you. Yeah. But I just can't get my head around how you did it. And I understand why you did it. Yeah, I can see that actually one, being in silence, not having children around and family around and people around to bother you at that point when you're feeling like that is probably a really big positive. But it also meant that when you were feeling like that, you had to force yourself to get up. You had to force yourself to eat, to drink, and to have self-care. And I know when I'm feeling ill, how much I struggle with that. And that's without having chemicals being pumped into my body to try and fight something that's very aggressive and could potentially kill me. So with that also going on in your mind at the same time, you know, I think anybody watching this will be blown away by the fact that you did this all by yourself. Again, I'm not downplaying what your friends did, but at the end of the day, you live by yourself and you still had to carry on as normal, and you did. And you're just like Wonder Woman to me. Honestly, you are.
Thank you.
And I think what also I just find amazing about you is that you have taken so much positivity from it. And I remember I wanted to talk about something else actually. I remember we had a conversation and it was about when you cut your hair into a bob.
Oh, yes.
Because your hair hadn't always been a bob.
No, it's been very long, what is it, wavy, yeah. But yes, my friend told me she had some what you call scissors that especially for like cutting hair. And I was like, okay, fine, let's just get it cut. She just took it up in a ponytail and then literally cut it, and it was not even. Like, it wasn't even close to being even at all. And then and I was so, because I needed to be very careful with my hair, like I couldn't put too much, so I didn't want it to go to a proper hairdresser, because they would put products, they would do anything, and it would still cost me a fortune to kind of get my hair done.
So we're going to just go through some statistics for breast cancer. And worldwide, breast cancer has now surpassed lung cancer. It's the most commonly diagnosed cancer, and there's an estimated 2.261 million new cases of breast cancer diagnosed in women across the world in 2020. That's a huge amount of women. And in 2020, 11.7% of all cancers diagnosed were female breast cancer. This is what I was saying. Belgium had the highest rate of cancer in women in 2020, followed by the Netherlands. And then Barbados had the highest risk of breast cancer mortality in women in 2020, followed by Fiji. That's crazy statistics. I wonder if that's more to do with the healthcare system there. It's got to be.
Potentially.
It's got to be.
It probably will be, yeah.
It's got to be.
Or the treatment, or the way that they actually figure out how this specific breast cancer needs to be treated. Yeah.
So here's some UK statistics. There are around 56,000 new cases of breast cancer every year. That's over 150 cases every day. In women, on average, there were 55,500 new cases each year. And 18% of breast cancers were in women under 50. And 82% in those 50 or older. So that relates to what you were saying about you still being young, because you were in your 30s. It's the most common cancer in the UK. Breast cancer is the most common cancer in the UK. And it represents 15% of all new cancer cases. 24% of breast cancers occurred in women over 75. So 24% of breast cancers occurred in women over 75. So clinics that are known to treat breast cancer are St. Bart's Hospital's renowned for it, isn't it? St. Bart's. Which hospital were you at?
London Bridge, Guy's, yeah.
So that Whipps Cross, Newham, Royal Marsden, Guy's, and UCLH. So different types of treatments we've already talked about. So it says breast cancer treatments can be highly effective, achieving survival probabilities of 90% or higher, which is amazing how well the medical industry has come along.
Mm-hmm.
81% of patients diagnosed with breast cancer have surgery to remove the tumour as part of their primary cancer treatment, same as you. 63% of patients diagnosed with breast cancer have radiotherapy as part of their primary cancer treatment, same as you. 34% of patients diagnosed with breast cancer have chemotherapy as part of their primary cancer treatment. So that's actually the minority, and you were one of those because of how aggressive your form was, triple negative.
Mm-hmm.
So treatment usually consists of surgery, which we spoke about, radiation therapy, systemic therapy, so that's anti-cancer medicines given by mouth or intravenously, and to stop the cancer and to treat or reduce the risk of cancer spreading. And anti-cancer medications include endocrine, hormone therapy, chemotherapy, and in some cases targeted biological therapy. So there's antibody treatments. So in the past, mastectomy was the go-to answer, which you talked about. We talked about that, which is a complete removal of the breast tissue and then usually re-implanting with a silicone or some kind of implant. But today, because of the developments of the medical industry, that they now do the lumpectomy. That's a preferred treatment rather than taking the whole breast, because taking the whole breast is actually something they try not to do.
It's very traumatic, actually. Yeah.
I mean, I'm a woman, and if you say, how would you tell a woman from a man? There's very few things that are different, and one of them is that we have breasts. So I think if I had to get rid of my boobs at any point in my life, I don't know how I would feel about that. I would be the person that says I'm having a breast implant. I would not be not having breast implants. When they spoke to you about that, did you ever consider would you have considered, if you had to have all your tissue removed, would you have considered as implants?
Yes, I did consider it to begin with, and this was what I talked to my doctor about. Just because the triple negative is also one of them that is well considered back in the days. There's been so much research about it today, but if obviously when you start Googling stuff, you should never Google.
No,
ever God. Google. But that I did Google, and on the internet it is the most reoccurring one. So I obviously panicked. Where my medical team said, no, there's been so much research since then. Things are different now. There's different treatments and all this stuff. And my doctor said, it's obviously all up to you, but you're so young. And let's do the lumpectomy first. And then, if and only if it reoccurs, then we can talk about it. But the chances would be, very low today because there is such a good treatment within it. I was actually quite lucky that I actually accidentally ended up at Guy's hospital. They are the biggest researcher within my type of cancer.
Wow.
So I was obviously, because everything started working on me, so they actually used me quite a lot as a lab rat.
Test study.
So wow. They took a lot of my bloods and to thoroughly go through all their research. So I was actually quite lucky I ended up where I did. So I had this decision, and I ended up making the decision of just getting the lump removed, and I am very pleased with that today. I love my breasts today. They've done a really, really amazing job. The doctors that's at Guy's Hospital has really, they are perfect.
Good.
Yeah.
After all that, at least something good came out of it.
Yeah.
So I'm going to ask you something. if you could give men and women, because it does occur in men as well, one piece of advice moving forward with your life, what would you give people? What advice would you say?
Well, there will be many, but
let's keep it relating to breast cancer to start with.
Yeah. Well, first of all, obviously touch yourself. Make sure. Well, what was the right way of saying it? Check yourself. Yeah. Make sure to check yourself, and if there is something, just a little lump or anything you're a little bit unsure about, get it checked. Absolutely, get it checked. Even if a majority of your GPs today would actually just refer you, because it is such an important place, and the sooner you can discover it, the higher is your risk of survival. So definitely check yourself.
Check yourself. I think what we'll do also is, in the description for this video, we'll put a little link down of a cancer charity on how to correctly check your breasts so that you're doing it right, because there is right and wrong way to do it. Because like you said at the beginning, our hormones as women change monthly, and our breast tissue does become lumpy at certain times of the month. So as women, we're supposed to check our breasts between certain days and dates of our cycle. So I think I'll ask the editing team to add that in the description, so you've got somewhere to refer back to, so that everybody has somewhere to refer back to, so that when you say your advice is check yourself, it also goes for testicles and anything else.
Anything. And also, I obviously don't know, but majority of the time cancer doesn't hurt, so it won't be painful. So that is where not saying you need to be concerned, but get it checked properly. Go to GP and get it proper checked, because
that's how it can fly under the radar, essentially, because it's not a hurt on your knee. It's a growth that actually doesn't hurt. I'm okay.
I'm fine.
It could be anything. So that's a really good piece of advice. But I want you to give people, because you have got such a positive outlook on life and you have worked on yourself to such a massive extent, what advice would you give to people going through what you went through now? What advice would you give them?
That's a good.
It's a big one, isn't it?
Big question, yeah. I would say that during that period of time, you will learn so much about yourself, and I would say that always try to think of yourself in a positive way. It's a big question. Just that whatever you have to go through in once you've been diagnosed, is that it's just to take care of yourself, make sure you are as healthy as you can be.
One thing that I've got from this is something that kind of runs through a lot of my podcasts, which is try and find the positive in the situation, which is what you did.
Yeah.
So although you were in pain, you weren't feeling well, you were alone, you were losing your hair, you were having to have this nasty treatment, taking time off work, going to and from hospital, having operations, you took a positive from this. And that positive is that you have worked on yourself as a person, and you've actually grown to love yourself more, and that you're seizing life more.
Yeah.
Which is a cliche, isn't it?
Yeah.
Oh yeah, I had a brush with death, and now I wanna. Do you know what I mean? I hear it, but actually, it's real.
It is real. Like, it is 100% real. Like, I could have chosen to have gone into that deep hole that would swallow you up, like whole raw, basically. But I really wanted to make this the best thing that's actually ever happened to me. Like I pretty much got like a kick in the bum, pretty much out of this, or I kicked myself in the bum more to actually come out of it with, a positive outlook. I'm as happy as I've ever been today.
Such a wonderful thing to hear that after all of that, like you said, you didn't go into that dark dip of pit of despair. You picked yourself up when you were on the verge, and today you're in a really amazing place. And I'm really proud of you.
Thank you.
And I know we're not in constant contact. I'm not going to lie and say we are, but whenever I catch up with you, you're like a breath of fresh air. And you have been today as well. And I know this wasn't an easy thing for you to talk about.
No.
It wouldn't be an easy thing for anyone to talk about, but I know it wasn't an easy thing for you to talk about. I really do appreciate you coming and doing this, because I think if we can help one person actually check themselves, don't touch yourself, check yourself. Give yourself a check, once a month, once every 2 months, just do that, take that step, because it's not anything to be afraid of. And the least that they can say is it's nothing. Far better that you get told that something is nothing. I've actually been and had 2 mammograms done because I found lumps on one of my breasts, one down at the bottom and one quite close up to the top. I didn't have as good of an experience as you, I'll be honest.
Okay.
The first time I went, they were fine and they were really helpful. And then the second time I went, the woman looked on my notes and she went, "Oh, you were here 6 months ago. What are you doing wasting our time?" And I looked at her and I said, "It's not the same lump. It's in a completely different place. And would you rather I don't go to the doctor when I've got a lump in my breast?" And she checked herself. I think she was quite surprised that I stood up for myself when she said that. Yeah. And then she kind of took a step back, and I think she realised that actually what she said was completely wrong.
That's completely out of the order, actually.
It is, but I now, because I dealt with a lot of ladies like yourself, if I feel that there's something there that wasn't there before, I don't care, I'm getting it checked.
Oh, no. Yeah.
And if they tell me it's nothing, thank God. But if I have missed it and not gone to get it checked, and then I end up, my children not having a mother, that is the far worst thing to happen. Just like for you, it would have been far worse for you not to be here now because you didn't get it checked.
Yeah.
So I think the key to this is you should never not go to the doctor if something's bothering you. I know that our NHS is overstretched, but reality is that we usually know our own bodies, and if something's abnormal, we should tell the doctor. And that there's no shame in going and getting checked and it not being anything. It's just a blessing when it's not.
Oh, yeah, definitely.
100%.
Yeah.
So let's leave it there.
Okay.
Thank you so much.
Thank you.
I really appreciate your time. And you rushed all the way over here to see me from work. But thank you. And I really appreciate it. And if anybody has any comments or questions, don't hesitate to put them in the comments down below. We'll link as many helplines or sources of information as possible on this post. Eva, thank you so much for joining me. And guys, thank you for watching. Don't forget to hit subscribe, like, and comment.